Let me ask you something really personal right now. How many times did you wake up last night to use the bathroom? Once? Twice? Maybe 3 times or more? And if you're being honest with yourself, when was the last time you actually slept through an entire night without that familiar urge pulling you out of a deep sleep, forcing you to stumble to the bathroom in the dark, half awake, hoping you can fall back asleep quickly, but often lying there for another 45 minutes staring at the ceiling? If that sounds like you, I want you to know something really important right now. You are not alone, and more importantly, this is not something you just have to accept as your new normal. I've worked with a lot of people over the years who come to me exhausted, frustrated, and honestly a little embarrassed to even bring this up. They've been dealing with nighttime bathroom trips for months, sometimes years, and they've just started to assume it's part of getting older, or that there's nothing they can really do about it. And every single time I hear that, my heart goes out to them. Because the truth is, there is so much you can do. And that's exactly why I made this video today. Because I want to walk you through something practical, something you can actually start tonight, that can dramatically reduce or even completely stop those nighttime bathroom runs. Before we get into it, I want to ask you a quick question. And I really want you to answer this one in the comments below. How many times on average do you wake up at night to use the bathroom? Just type the number 1, 2, 3, or more. I read every single comment, and your answer is going to help me understand exactly what you're going through so I can keep creating the most helpful content for you. So go ahead and drop that number down below right now. Okay, let's get into this. The medical term for waking up at night to urinate is called nocturia. And I want to be clear. Getting up once in a while is not unusual. But when it's happening consistently, when it's interrupting your sleep night after night, when you wake up feeling like you never really rested, that is a quality of life issue that deserves real attention. Poor sleep doesn't just leave you tired. It affects your mood, your metabolism, your immune system, your heart health, your cognitive function, and your hormonal balance. So solving this problem isn't just about comfort. It's about your overall health and longevity. Now here's the first thing I want you to understand. Nocturia is almost always a symptom, not a disease in itself. That means there is something, or sometimes a combination of things, driving it. And when we identify and address those root causes, the nighttime urination often resolves on its own, or becomes far more manageable. So let me walk you through the most common causes, because once you understand what's driving this for you personally, the solutions are going to make so much more sense. The number one reason most people are waking up at night to pee is actually not about their bladder at all. It's about fluid timing and retention. Here's what I mean. Throughout the day, especially if you're sitting at a desk or on your feet for hours, fluid tends to pool in your legs and lower body. It's a normal physiological process. But when you lie down at night and elevate your legs to the level of your heart, your body starts reabsorbing all of that fluid back into the bloodstream. Your kidneys then have to filter and process that extra fluid, which means your bladder fills up and you wake up needing to go. This is one of the most overlooked causes of nocturia, and once you understand it, you'll start to see why the simple hack I'm going to share with you in a moment works so well. The second major cause is what I call the evening fluid trap. I see this pattern constantly. People are busy during the day, they don't drink enough water, and then in the evenings they suddenly realize they're thirsty and they start drinking a lot. Tea, water, juice, maybe a couple of glasses of wine or beer. All of that fluid intake, concentrated in the last 3 to 4 hours before bed, goes directly to your kidneys and your bladder overnight. And your body has no choice but to wake you up to deal with it. The timing of what you drink is just as important as how much you drink. The third cause is caffeine and alcohol. I know this might be hard to hear, but both of these are diuretics, meaning they actively tell your kidneys to produce more urine. Caffeine, even from tea or chocolate or soda consumed in the afternoon, can still be affecting your kidney function late into the evening. Alcohol is often an even bigger culprit than people realize. Many people think that a glass of wine helps them sleep, and it does knock you out faster. But the way your body metabolizes alcohol during the night disrupts your sleep architecture and increases urine production in the second half of the night. So you might fall asleep easily, but then wake up at 2 or 3 in the morning needing to go. The fourth cause worth knowing about is sleep apnea. This one surprises a lot of people. When you stop breathing during sleep due to sleep apnea, your brain wakes your body up, and your body interprets that arousal as a signal to urinate. There's also a hormone called ANP, atrial natriuretic peptide, that gets released during the strain of struggling to breathe, and it directly signals the kidneys to increase urine output. If you wake up at night to pee and you snore, feel exhausted during the day, or wake up with headaches, I strongly encourage you to speak with your doctor about a sleep study. Treating sleep apnea alone often resolves nocturia completely. The fifth cause is simply the natural changes that happen in the body over time. As we age, our bodies produce less of a hormone called ADH, antidiuretic hormone, also known as vasopressin. This hormone normally tells the kidneys to hold on to water during the night and concentrate urine so you can sleep through without waking. When ADH production declines, the kidneys become less efficient at doing this overnight, and urine production stays more constant throughout the day and night. For women going through perimenopause or menopause, the drop in estrogen also affects bladder sensitivity and capacity. For men, prostate changes can reduce the bladder's ability to fully empty, which means the bladder reaches its full signal much faster. There are also medications, blood pressure medications especially, like ACE inhibitors and diuretics, that can directly increase nighttime urine production. If you're on blood pressure medication and you're experiencing nocturia, please talk to your doctor about timing. Simply shifting when you take your medication can sometimes make a significant difference. Now let me tell you about the 10-minute hack. This is not some miracle pill or some overcomplicated routine. This is a simple, evidence-backed 10-minute window of activity that you do in the late afternoon, ideally between 4 and 6 p.m., and it directly targets that fluid pooling in your legs that I described earlier. What you're going to do is lie down flat and elevate your legs above the level of your heart for 10 minutes. That's it. Put your feet up on the couch, prop them on some pillows, lay on your bed and rest your legs against the wall. Whatever works for you. Just make sure your legs are genuinely above heart level for 10 full minutes. Here's the science behind why this is so powerful. When you elevate your legs in the afternoon, you're allowing all that pooled fluid to drain back into your circulation before you go to sleep. Your kidneys then process and excrete that fluid while you're still awake, not while you're sleeping. By the time you lie down for bed, your body has already dealt with the bulk of that excess fluid, and there's far less for your kidneys to process overnight. Multiple studies have shown that this simple intervention can reduce nighttime voiding episodes significantly, sometimes by 1 to 2 trips per night in just the first week of doing it consistently. And here's the thing. You can combine this with a few other targeted strategies to make it even more effective. First, compress your fluid intake. I'm not telling you to drink less overall. Staying hydrated is genuinely important for your health. What I'm telling you is to front-load your fluids. Drink the majority of your water earlier in the day, and then taper off after 6 p.m. Try to stop drinking large amounts of liquid at least 2 to 3 hours before bed. Small sips are fine if you're thirsty, but no large glasses of water, juice, or any other beverage close to bedtime. Second, watch your salt intake. This one is sneaky. High salt in your diet causes your body to retain more fluid during the day, which means more of that fluid ends up pooling in your tissues, and then getting processed overnight when you lie down. Reducing your sodium intake, especially at dinner, can meaningfully reduce nighttime urine production. Swap salty snacks for something lower in sodium, and be mindful of how much salt is in your evening meal. Third, do a double void before bed. This is a urological technique that's incredibly simple but surprisingly effective. When you go to the bathroom before bed, after you finish urinating, stand up, take a few steps, then sit back down and try to go again. Moving around slightly shifts the position of your bladder and often allows a bit more urine that was trapped in the bladder neck to drain out. By fully emptying your bladder before sleep, you effectively give yourself a little more time before it refills to the point of waking you up. Fourth, consider your pelvic floor. This might not be something you've thought about before, but weak pelvic floor muscles can contribute to urgency and a reduced ability to hold urine overnight. Gentle pelvic floor exercises, often called Kegel exercises, strengthen the muscles that support your bladder and urethra. To do a Kegel, you simply contract the muscles you'd use to stop the flow of urine midstream, hold for 3 to 5 seconds, then release. Aim for 10 repetitions 3 times a day. You can do them while sitting at your desk, watching TV, or even lying in bed. It takes a few weeks to notice the difference, but the improvement in bladder control is very real. Fifth, be mindful of bladder irritants. Beyond caffeine and alcohol, there are other common foods and drinks that can irritate the bladder lining and increase urgency and frequency. These include carbonated drinks, citrus fruits and juices, tomato-based foods, spicy foods, and artificial sweeteners. I'm not saying you need to eliminate all of these forever, but if you're struggling with nocturia, cutting back on these in the evening can make a noticeable difference in how often your bladder demands your attention overnight. Now, I also want to talk about something that a lot of people deal with but rarely discuss openly, and that's the anxiety loop that develops around nocturia. What happens is this. After months of waking up multiple times a night, your brain starts to anticipate it. You become a lighter sleeper. You start half waking up checking whether you need to go. Sometimes you get up, just to be safe, even when the urge isn't that strong, because you're afraid of waking up later. This is your nervous system trying to protect you, but it actually reinforces the pattern and makes it worse. One of the most important shifts you can make is to trust your bladder more. As you implement these strategies and your nighttime urination decreases, give yourself permission to stay in bed longer when the urge is mild. Your bladder can hold more than you think, and teaching it to hold a little longer gradually retrains both your bladder and your brain. I also want to be very honest with you about something. While all of these strategies are genuinely effective for the majority of people dealing with common nocturia, there are situations where nighttime urination is a sign of something that needs medical attention. If you are also experiencing unusual thirst, unexplained weight changes, swelling in your legs that doesn't go away, pain or burning when you urinate, blood in your urine, or if you have a history of heart disease, kidney disease, or diabetes that isn't well controlled, please don't rely on YouTube videos alone. Please talk to your doctor. These strategies are meant to empower you and support your well-being, not to replace a professional medical evaluation. Your health is worth that conversation. For the majority of you, though, the combination of the 10-minute leg elevation, front-loading your fluids, reducing evening salt, doing a double void before bed, strengthening your pelvic floor, and cutting back on caffeine and alcohol in the afternoon and evening. That combination is going to make a real, tangible difference in how you sleep. And I want you to think about what that actually means. It means waking up in the morning genuinely rested. It means better energy, better focus, better mood. It means not dreading going to bed because you know you're just going to be woken up again. It means deeper, more restorative sleep that supports everything from your metabolism to your mental health to your immune system. That's not a small thing. That's everything. So here's what I want you to do right now. Start tonight. Literally tonight. Set a timer for 4 or 5 in the afternoon to remind yourself to elevate your legs for 10 minutes. Put a sticky note by your water bottle, reminding you to drink most of your fluids before 6 p.m. And before you get into bed, do that double void. Just those 3 things alone, starting tonight, can begin to change your pattern. You don't have to overhaul your entire life to get better sleep. You just have to start with one evening, one night, and build from there. And if this video helped you, I really want to hear about it. Drop a comment below and tell me how many times you typically wake up right now, and then come back in a week and let me know if things have changed. Your story might be exactly what someone else needs to hear to finally take that first step. And if you know someone who's been struggling with this, a parent, a partner, a friend, share this video with them. Because this is genuinely the kind of information that changes lives, and it deserves to reach as many people as possible. I'm here for you. I'm rooting for you. And I truly believe that tonight can be different. Sleep well. You've absolutely earned it.